before we dive in and before you get to see my colleagues, I'm just going to go over the medical history with you, and then I'm going to listen to your heart, lungs, and take your blood pressure. Sound good? Okay, very good. Now, do you have any allergies that you know of? Okay, can you confirm me your date of birth, please? Good. Alright, do you take any medication right now? Okay, how often? Okay, anything else? Alright, when was the last time you had your cholesterol measured? Do you remember if the result was abnormal or the same, good, healthy? Okay. Have you ever had a colonoscopy? Mammogram, pap smear, bone density test? Alright, as for your vaccinations, did you get the last tetanus shot? Did you get all of them? Do you remember if you got a booster? Okay. When's the last time you ever had a flu vaccine? Usually it's just for like elderly people and people who are of risk, but it doesn't mean that you can't have had a flu shot before. Alright, shingles vaccine? Okay. Pneumonia, I've had anything for that? Alright, good. Now, are you currently an alcoholic or a drug abuser? Or in denial, that's an option too. No, that you know of that has been. Okay. Are you an asthma patient? Have you ever had cancer, or has it ever been diagnosed with you? Okay. Any depression, anxiety, bipolar, suicidal thoughts? Have you seen a psychiatrist or psychologist in the past few years? Alright, diabetes? Okay, heart disease, high blood pressure, any of those, high cholesterol, as far as you know? Okay. Have you ever had thyroid issues? Okay, migraines? You know there is a difference between having a migraine or having a migraine. Usually people say they have a migraine when they have a bad headache, but actually migraine is really a certain issue. It's a specific type of headache and it usually just knocks you straight out. Usually when people have migraine attacks, they are not capable of really doing much for at least a couple of hours, and that can last up to a couple of days, a week. Alright, what were the most recent surgeries or prominent ones that you've had? Okay, remember the year? Good. Let's see. Let's have. Is there like anything significant to your family history, like strokes, cancer patients, anything alcohol, drug related. Good. Are you currently retired, unemployed? Okay. Right. What is the highest degree that you have been able to do? That you had the opportunity to do? Okay. Do you do night shifts at all? Ever had? Done? Have you ever had to do night shifts? What is your marital status? Okay, children. Very nice. Okay, do you currently smoke? What do you do for exercise? Okay. How many hours would you say that you're sleeping at night on average? Okay. And how is your diet? Do you think it's good, bad, average? Got some healthy options, but you do like fast food? That's fine. Okay. That's not really necessary. Do you currently see another specialist at all? Okay. Have you travelled outside of your country in the past 6 months? Were you ever in the military and deployed? Okay. Come on, people. Let's see. So, today I want to have you see an ENT specialist. Okay. After, I would like for you to see a dermatologist as well. Quite important. Let's see. And then I'd like to have your scalp checked as well, and then maybe we should do like a cranial nerve exam to just make sure that we've got everything good going. Let's see. And maybe we could. That's good. So ENT, dermatologist, cranial nerve exam, and a scalp inspection. I think that will be the most important things for now. Alright, so I'm just going to sign this off, and then I'm going to go and get the next doctor for you, okay? Right, I'm going to first do what I said I was going to do, right? Okay, do you know if you've got a fever at all? Alright, good. Just sit still, keep breathing in and out very nicely, okay? It's a bit cold. And give me a very deep breath in and just hold it there. Okay, thank you. Just breathe out. Thank you. I'm just going to have a very slightly better listen here. a very nice heart rhythm. Okay, I'm going to leave this one hanging. Now for blood pressure. Can I have your arm, please? Perfect. Thank you. I'm just going to go ahead. I'm just going to pump this bad boy up. Nice and tight. There we go. I'm just going to pop this here, and I'm going to just pop this underneath. Just a little bit more. Okay. Good. I'm just going to get rid of all of this. There we go. Place that there. Okay. Perfect. Thank you. That's all I needed to know. Great. So, as I said, to get Dr. Sophie, she's the ENT doctor, and she'll continue the examination. Okay. Thank you for meeting me, and I'll see you later. Alright? Bye bye. Right, hi, so I'm Dr. Sophie, I'm your ENT doctor, okay? So, let's get the nose out of the way, shall we? I'm just going to start by just doing your nose. What do you think? I don't think anybody likes me going up their noses, so let's just make this very quick. Alright, okay, just tilt your head back just a bit. I'm just going to use this to hold the nose open. It is not going any deeper than this. Okay, right, this is not a COVID test. I'm just going to shine a light, alright? Okay. Better. Okay, now let's do that again. Just keeping this open. Okay, so I'm happy to see that your nose hairs are intact. That was quite the Irish accent. Nose hairs. Your nose hairs are quite intact. Very important to keep the wrong things out. Yes. It's very good. And I do like the colour of your snot as well, so it's just a nice translucent colour, just the way it's healthy and supposed to be, okay? If you have like a very bright green or a bright yellow, or if it's like a milky white, there's a few issues, okay? You could be struggling with infection, you could actually have multiple types of diseases, you could just be congested, but in your case, all good. Can I just touch your nose for a bit? Yeah? Okay. So I'm just going to I'm just going to pop on some gloves. Why don't you put your finger to your one nostril and blow out. Now you do the same on the other side, okay? Alright, so did you feel the difference? Yeah? That is actually quite normal. There is always one side, one nostril, that is actually in a passive mode. And it does switch during the day. So it's actually the middle of your nose, like the middle cartilage part, that just shifts a bit during the day. So it's very normal that you have an active side and a non-active side. Perfectly normal, but can be bothersome if you need a correction there. Okay? Great, let's continue. Can you open wide for me? The mouth, by the way, just quickly. Alright. Have you ever had tonsil stones? Did you have your tonsils removed? Alright. Okay. Can you lift up your tongue for me? Beautiful. Here as well. When was your last visit to the dentist? You need to go more often. Okay, even if you don't have any issues. Okay. Right, so I'm just going to feel around your throat here, okay? Feeling for your notes. Just making sure that all is well. There's no swelling and no abnormalities. We won't want that. Okay, that seems great to me. Can you just shift your head that way? That way? Alright, can you swallow for me? Good. Can you cough? Okay, great. Let's move on to your ears, okay? I'm just going to use my light here. Okay. I'm just going to have a quick look, making sure I'm not riding over your toes. Okay. Do you use cotton swabs in your ears? Okay, just going to have a look on the other side now. So there's a little bit of earwax, but it's a nice deep yellow color, so that's healthy. Having earwax is also a defense mechanism of your body, so there's actually no use of removing it. It's going to go away, and it's actually resolving everything by itself. Okay, so you don't actually have to do anything for that. If your earwax is really bothering you, you can always have it professionally cleaned. Okay. I actually have a great colleague for that. she isn't available today, but you can sure make an appointment with her. Her name is Dr. Sophie. Yeah. Okay. I'm just going to remove the gloves, and I'd like to just do a few quick hearing tests. Okay? I can snip my fingers. You close your eyes. I'm going to hold my fingers next to your ears. I think I'm hungry. It's my lunch break after this, or evening break, whatever you want to call it. And tell me when you hear it right or left. Okay? Awesome. Okay, well, that's great. I was actually thinking. Okay, close your eyes. I'm going to say a few random words and you just repeat after me. Okay? Alright. Lip gloss. Ferrari. Thunderstorm. Peacock. Okay. Well, that's actually great for me already. You don't have any concerns? Do you have any beeping that you're hearing sometimes? Okay. Well, I suggest if you have any concerns whatsoever, just make an appointment with me, okay? And then we'll just figure it out if need be, okay? Other than that, I am going to send in Dr. Sophie, okay? She's a dermatologist. She's amazing. She gives such relaxing face inspections, okay? So I'll go get her, tell her you're ready, and then maybe I'll see you next time. Alright? Awesome. Bye now. Hi. So I'm Dr. Sophie, okay? I'm the dermatologist here in this facility. Alright. I'm dying to look at your face. Okay. Can I touch you? I am wearing gloves. Okay, perfect. Thank you. Now, talk to me. Do you have any skin concerns? Okay. Any risk history of acne? Have you ever taken Roaccutane? Okay. How's your water intake? Does that include coffee, juices? Okay. Just try to drink a little bit more water. Okay. Now, dangerous question. Do you use sunscreen? Well, you know, I can really recommend the sunscreen by Beauty of Joseon. It doesn't leave a white cast. Goes on smoothly under any makeup if you wish. SPF 50. It's absolutely great, very soft, moisturizing. Doesn't look greasy, you know. Just please don't try to make your own sunscreen, okay? You're just making butt cream for babies. Busting cream. Just because there is zinc oxide in your cream doesn't make it sunscreen. walk me through your skincare routine, please? Looks like some pigmentation here and there. But that's okay, that's perfectly normal, but I do like to see if it's all under control. Can you just close your eyes for me for a minute? Okay. Okay, thank you. You can reopen. Can you just look up for me? I can see your under eye. There we are, just a tad better. Looking for dark circles, melia, the traditional stuff. Can you just lift your chin up for me? How did you like the ENT doctor? Dr. Sophie, right? Yeah. Did you like her? Was she nice? She's kind of been a staple here. I think she has a YouTube channel. I think you should subscribe to her. Yeah, she's gonna like that. She is going to like that very much. Okay, great. Just going to check your hairline here very quickly too. Okay. How often do you wash your hair? Great. Okay, so today I'm not going to be the one performing a scalp check. Okay, we have a dedicated person for that now. I've got places to go, people to see, so let me just check your moles too. Okay, I really need to check those. Check for melanoma. And in all transparency, I do like to work with the ABCDE diagnostic method. So asymmetry, border, color, this one is fine, diameter and evolution. Now, evolution is not something that we can check today, right? And I'm also just looking at your pigmentation from up close. Make sure that it doesn't have the potential to evolve in something malignant. So on here as well. Right. Good. That is all good for me. I'm going to be able to put my tools there. Alright, I'm just going to have a feel overall, texture wise, a little bit more. I'm just going to press a bit around, okay? Just check your skin elasticity. Okay. Now remember, try to drink a little bit more water, okay? Please use sunscreen and at least a moisturizer, please. It's very important. Keep searching and looking for the perfect skincare for you, okay? Awesome. Oh, you should know, your next doctor is for the cranial nerve exam. She's great. Her name is Dr. Sophie, and honestly, she's the best. She knows her stuff very well, so actually I should make a new appointment with her. Oh well. Have fun. Good luck. Everything seems good so far. Coming in hot. Squeaky. Beautiful day to wear blue now. Alright, good. I'm Dr. Sophie and I'm going to do your cranial nerve exam today. Alright, let's see. I see you've already met Dr. Sophie, Dr. Sophie, Dr. Sophie. I love those women, just love them. Can you look straight ahead for me, please? Okay, good. Just going to look at your pupil reflexes. Close your eyes for me. Thank you. And reopen. Good. Close your eyes again and reopen. Okay. Just going to cover one eye. That's good. That is very good. Okay, can you follow my lights, please? Okay, very nice. Can you look up for me? Thank you. Okay, can you look down for me so it's slightly pull up your eyelid there. Okay, that's very good. Now you need to think really fast, okay? I'm going to show you an amount of fingers. You tell me how many fingers you see, okay? Think fast. I'm going fast too. Go. Okay. It's been a long day. Alright, can you keep your head still for me? Move your eyes to your left, to your right. Okay, look here, and down here, here, here. Can you roll your eyes for me? Thank you, but I'm pretty sure you can do it even better, okay? Give me a good eye roll. Okay, thank you, much better. And no, I'm not insulted. Okay, can you try and keep looking at my nose, but you just move your head from side to side, okay? Alright, now tilt your head up, keep looking at my nose, tilt your head down as far as you can, keep looking at my nose. Okay, Okay, very nice. Can you follow my finger? Okay, just going to touch your nose. Good, great. Great. Now you do it. Grab your finger, touch your nose, touch mine, but keep looking at your finger. Okay, good. Now do the same thing, but keep looking at my eyes, and you just keep coordinating your finger. Okay, don't look at your finger. Alright, that's okay, thank you. Good. Just going to do a quick sensitivity test, okay? I've got something sharp, I've got something soft. Close your eyes, tell me when you feel what. Okay, let's go. Okay, went fairly well. I'm just going to check your reflexes. Okay, so just sit straight for me. Right, leave your hands to rest on your legs, okay, and direct your knees forward, feet next to each other, please. Awesome sauce. Just going to give you a quick nick on the elbows and the knees. Alright. Okay, just relax. Beautiful. Relax. One more time. Okay, we had a bit of a delayed response there, but that's okay. Great. Now, your elbow, please. Just relax. Better. Now this side for me. Just relax your arm. Good. Can you wiggle your toes for me? Okay. Can you wiggle your right toes only? Good. Just wiggle your fingers. Good. Your left fingers only. Great. Can I just see your nails for a second? Nails are a great indicator of our health. So. Alright, thank you. Now, smell this. Tell me what you smell. Okay. How about this? It is quite the opposite. Okay, that is good to me. Okay, now this is a fun one. Just going to check your perception of colors. Alright, what is this color? This one. How about this? Good. and this. Okay, and if this is brown, what is this color? Good. And this? Okay. Last one. That's not grey. Try again. Kidding. It is grey. Okay, now I'd like to do an additional one. Moment. Alright, which of these is darker? This one, good. Which of these is darker? This one as well. Okay, I'm just going to switch through them and show you them one by one, and you tell me if I'm showing you the lighter one or the darker one. The lighter one. Very good. Okay, let's see. I think I've got tested you for everything, I believe. Right? We could go in more depth, but you're obviously quite healthy and we could just schedule a separate appointment as well, okay? Now, you're about to meet Dr. Sophie. She's great. She's the scalp queen of this facility, okay? You're going to like her so much. Enjoy the scalp inspection. You're going to like it. Send her my regards. Hi, I'm Dr. Sophie, and they say that I've got the funnest job because I get to play with people's hair. I'm just going to use some disinfectant. If it's okay, I'm not going to use gloves for this one. There we go. Just some hand sanitizer. Okay. Okay, well, tell me, what do you think of Dr. Sophie? No, Dr. Sophie, the ENT doctor. Yeah, she's great, right? Yeah. Well, I think Dr. Sophie is so great. Every time I have a mole or if I have an insecurity about my skin, she's always the first I go to. Hands down. Okay. Tell me about your hair and scalp issues, okay? I'm going to pull your hair forward a bit. Just going to look at the condition of your ends here. Alright. Okay, that is not too bad. I'm just going to bump myself up a bit. Just going to have a look at your scalp. Do you have any itching sometimes? Okay. How often do you brush your hair? And what shampoo do you currently use? Okay. How long have you been using that shampoo for in like one sitting without changing shampoos in between? Okay, so I'm just looking around and grab my light here. It's working today, that's nice. It allows me for easy navigation and good lighting. Do you know if you have bald patches that you know of yourself? Okay, I'm just going to check here. Do you get lice checks on a regular basis? Maybe just once a year, twice? Okay. Your hairline. How often do you change your bed sheets? Alright. Try to change them every 2 weeks. Because, like our pillowcases, for example, they do tend to accumulate a lot of dirt, and we don't need any of that. It is not a complaint, okay? Just trying to help you. Just some tips and tricks. Okay, now I would just like to see some of your scalp sensitivity. I can't really see any dandruff, so that makes me quite happy. I don't see any psoriasis or anything in there, like soreness. I need you to close your eyes, okay? I'm just going to point this. What has Dr. Sophie done with this bit? Anyway, I'm going to use this and just point a few areas on your scalp, okay? Tell me when you feel it, and tell me if it feels uncomfortable for you or not. Okay? Great. Good. Okay. Okay, that's it. I want to try something else. I think Dr. Sophie has used this combo as well. I'm going to do the sensitivity test on your scalp. Tell me when you feel something sharp or something soft. Okay. Mm-hmm. Good. Very good. Okay. Now, there's one last thing that I'd like to do. Okay, I just want to like cup your head and feel all around, just making sure there's like no bumps of any sort that I might be missing. Okay, so I'm just going to. Alright, well, honestly, I think you're all good. I saw the other Dr. Sophie's just walking about, very happy, so I think they themselves are very happy with the results, okay? So I suppose you'll get a phone call by Dr. Sophie just to analyze your results, and we'll see from there, okay? I'm happy from my side with my exam. I couldn't tell if there was anything wrong. Well, I could tell, but there's nothing wrong with your scalp wear. Keep doing what you're doing. You're doing great. No, I do hope you enjoyed it. Okay, before you leave, don't forget to subscribe and like the video, because you know, especially Dr. Sophie, she's very keen on that. So, okay, have a very nice day. Dr. Sophie